want to thank Sinn Féin first for bringing the motion, and Deputy Ward in particular. And the motion is very practical, and it includes two of the recommendations from Dr. Susan Finnerty's report. The motion is calling for, you accept that there has to be a clinical review and the timeline for that and when it be completed. And the second one, equally as important, immediate regulation of CAMHS under the Mental Health Act. And this report has pointed out, Dr. Finnerty has pointed out, they have absolutely, I'll quote, no legal power to enforce any action. The Mental Health Commission continues to monitor the actions taken on foot of these escalations, which I'll come back to, but has no legal power to enforce any action. That's a damning indictment. And so we're here again almost a year, or is it just over a year, since the other report from Dr. Maskey in January 21, following on from the brave whistleblower. And I must say, Ministers, I hope you can correct me, but my understanding is that this Dr. Sharma, the whistleblower, who was very courageous, has been treated very badly, sidelined, and was obliged to leave the country. Now, please correct me if I'm wrong. Is he working in Ireland? If you could tell me quietly, I don't mind. But my understanding is this man has suffered as a result of his courage. Now, that's an indictment of our system if that's what's happened. And please tell me I'm wrong about that, and I'll be the first to acknowledge it. As I said, it comes after the Maskey review in January 22 in relation to the South Kerry CAMHS. Now, I should declare I have a particular interest because in a different life, I worked as a clinical psychologist in a community care setting for many years with 3 monthly contracts. And when I got a permanent pensionable job, I refused to take it at the time because the job was advertised as a community care psychologist, which was brilliant, in the bad 80s. And then the system saw to put us back under what was called at the time the child guidance, which I thought was a retrograde step, which then became this entity, which has proven so not suited to the job. Because children with mental health issues of the nature that determines that they must go to a facility like this should be minute. And all of our efforts should be going into prevention, education, support, which was the model in the bad 80s, where people could walk in Bandaslow into the health centre and theoretically get a service. So backwards we've gone. But not alone have we gone backwards, but we have endangered our children. And this is from Susan Finnerty, who felt obliged, Dr. Susan Finnerty, to produce an interim report, although she hasn't completed her review of all the 9 CHO areas. But her concern was such that she said, I decided to issue an interim report because of the serious concerns and consequent risks for some patients, talking about children, that we have found across 4 out of 5 areas. These concerns include the risks to safety and well-being of children receiving or not receiving mental health services, or indeed receiving services that they shouldn't be receiving in terms of medication that's unmonitored, the management of that risk, and the lack of clinical governance. And she goes on to outline all of that. So far, she says, in this review, only on 5, we have made escalations of risk to the health executive and further up as well to the department in relation to risks. And then, quite startlingly, she tells us there were no risks pertaining to CAMHS documented within the HSE corporate risk register, and therefore no document actions. Now, it might be seen in bad taste, but 3 monkeys come to mind, where we see, hear, or do no evil. So no risk and nothing, and so we won't have any action on it. Clearly set out here. The symbolism of the 3 monkeys wasn't used by Dr. Finnerty, in fairness to her. In some areas reviewed, risk management was poor, with lack of communication and lack of actions to mitigate, a haphazard documenting of risks and minimalised generalised actions on the CHO register. All teams were significantly below the staffing levels, working beyond, and she pays tribute to the good work of them on the ground, but also highlights the serious problems, large variation, families frustrated up. Oh, the inappropriate use of emergency departments in local hospitals, the failure to facilitate the free movement between primary care, which really is non-existent, and these specialised services. Medication. There was evidence that some teams were not monitoring antipsychotic medication. No national standards, but they weren't even monitoring them in relation to international standards. No follow-up with appropriate blood tests and physical monitoring, which is essential. Children lost to follow-up. It's already been mentioned by lots of TDs, the amount of children lost to follow-up. Of serious concern was that in some CAMHS teams, children and young people with open cases have been lost to follow-up. For one team, there had been 140 lost cases. A very limited desktop review was carried out to identify these children and so on. Audits of clinical practice were rarely carried out. 4 of the 5 CHO visited areas used paper tails, no electronic recording. The rights of children, and they set out the rights of children under the UN Convention, which we've signed and ratified, and they clearly tell us, in her opinion, they appear, and that's a very moderate comment, we appear to have breached the European Convention on the rights of children, on the rights of the child, ratified in 1992. In the CHOs that we have reviewed to date, and that's only 5 out of 9, it appears that this right may have been breached for many children. I don't think there's any may. The long waiting list, the lack of capacity to provide therapeutic interventions, the lost cases, all point to a breach of Article 24. Even the team on the ground that wanted to escalate, they said it was pointless because when they did that, it went into a black hole and nothing happened. No ring fencing of funds for CAMHS, absolutely no ring fencing of funds. And then we have a special position, the child rapporteur. That's been vacant since last July, I think. There's good news today. The Minister has announced today or yesterday that there's a new rapporteur. Can you tell me, Ministers, why there was no rapporteur for the past 7 months since last July? The previous rapporteur, Dr. O'Mahony, gave his annual report, presented it to the government, pointed out that the delay in publishing these reports after they got them from him and generally is totally unacceptable, pointed out the difficulties in attracting somebody to that post. Why wasn't it proactive? Maybe you can answer, I don't know. I'm not here to give out. I'm here to express my outrage and upset, having read this report, that this could be happening now in our watch. And the failure to monitor medication, the question also has to be asked, and I'll finish, what were the GP roles in this? Was the medication just renewed by the GPs? You might elaborate a little bit on that. Each person has a responsibility, as each TD has, to do their best. Where was that with the GPs or whoever renewed the medication? Got a míle mágad.